I take this opportunity to invite our dignitaries to our virtual dais. Some of us are present already, and of course, we are waiting for a few more dignitaries to join in. May I please invite our President of Indian Association of Biological Psychiatry, Dr. U.C. Garg. It's a pleasure to invite our guest of honor, Professor Pratima Murthy, our patrons of the annual national conference, Dr. Neena Bohra and Dr. Rajesh Nagpal, our organizing chairperson and IABP vice president, Dr. Sunil Mittal, co-chairperson, Dr. Smita Deshpande, who's also an EC member of IABP, our organizing secretary, Dr. Deepak Raheja, the chair of our scientific committee, IABP, Dr. G. Prasad Rao, our joint secretary of IABP, Dr. Abdul Majid, the honorary treasurer, Dr. Prasanjit Ghosh, the honorary editor, Dr. Aleem Siddiqui, and our joint organizing secretary, Dr. Ankit Gupta. I welcome you all on the dais. Thank you so much for being here with us. And with this, we begin the ceremony by the traditional lighting of the lamp. So just give us a couple of, give us a few seconds, and we'll initiate that. We'll do the invocation.
Shubham kurutvam kalyanam arogyam dhanasampada. Shubham kurutvam kalyanam arogyam dhanasampada. Shatru buddhi vinashaya deepajyotir namostute. Deepajyotir namostute. Shubham kurutvam kalyanam arogyam dhanasampada. Shubham kurutvam kalyanam arogyam dhanasampada.
And with this, it's a pleasure and an honor to introduce to invite our chief guest of the evening, Professor Lakshmi Yatham, who woke up early in the morning to join us today. Welcome, sir.
Good morning. Thanks very much for inviting me. Hi. It is early morning indeed, and I got a little bit mixed up in terms of the time as well. But in any case, so it's a pleasure and honor to participate as a chief guest in the inauguration ceremony of this conference.
Thank you, sir.
And of course.
May I thank you so much, sir, for joining us. You were right on time, even though you got a little mixed up. We appreciate it. With this, I welcome Dr. Sunil Mittal, our organizing chairperson, to give us a welcoming address.
Welcome everyone to this IABP 17th Annual National Conference. IABP turns 18, so is measuring. And then of course we see that at this conference, well, because of the interest in biological psychiatry, the galaxy of star speakers, the themes and topics that have been picked up, and the registered number of delegates that we have has crossed 2,000. Which is immense. It's 2,200 or so. That's a large number. At any given time, I'm told that between 500 to 700 delegates are logged in for the lectures. So that's again a large number. And that's been all possible because of the team work that's gone in. And of course, the guests of honor, our chief guest, and at the valediction, the other guests of honor who are going to be there, they form these sparkling bookends, in between which is sandwiched the scientific program. So our chief guest, Dr. Lakshmi Yatham, our guest of honor today, Dr. Pratima Murthy, Dr. Lakshmi Yatham being the president of the World Federation of Societies of Biological Psychiatry, and Dr. Pratima Murthy, the director of NIMHANS, the Center of Excellence and Eminence. And in the valediction, we'll be having Dr. Afzal Javed, the president of the World Psychiatric Association, and Dr. B.N. Gangadhar, who currently is the president of the Ethics and Medical Registration Board of the National Medical Council. So we have eminent people for the inaugural oration and as well as for the valedictory oration. And let's not forget, both the president of the World Federation of Societies of Biological Psychiatry and the World Psychiatric Association come from this part of the world. They come from the Indian subcontinent. So that's credit to what happens in this part of this region of the world. The large number of delegates, like I said, have come in because of the science, which is the strength of the conference. And we have looked at, the scientific committee has looked at themes ranging from neuromodulation to, of course, deep brain stimulation. We had an eminent presentation there. The ethics that are involved in biological psychiatry, OCD, neuro-COVID, and then on to well-being, the neurobiology of well-being, and the interaction, therefore, with social neurosciences, if I may. And lectures, the essential award sessions, the free posters and papers are all here in these 2 days of conference. This conference, of course, been possible because due to an immense support from a large number of people, the conference organizers, the whole team of IABP, and so on. If you look closely at this conference, and I invite everybody who is here today attending to reflect and think, you know, I often refer to something as the human cognitome, the cognition, and the influences that go into making this cognitive, and by and large, the biological substrate that I'm made of, or you are made of, and everybody is made of. And overcoming the debate of the idea versus ideology versus the matter, if we look at the biological substrate, that's what affects everything, our behavior to even social behavior. And if we can have a meaningful dialogue with social sciences, social psychology, social psychiatry, and then, of course, combining the linguistics and philosophy, perhaps we can go back and think that we may be able to cross the last frontier of human knowledge and understanding, that of human consciousness. So I invite you to this exciting journey, which has begun today morning, shall go until tomorrow. Please join us for this conference. Welcome. Over to you, Rukshita.
Thank you so much, sir. With that, a brief report by me, the Honorary Secretary of IABP, respected dignitaries on the dais, the IABP, FMB, founding members, board, office bearers, EC members, and our dear colleagues and delegates. It's been a singular experience for me serving as the Honorary Secretary of IABP since February 2021. IABP has always been dedicated to promoting and advancing biological psychiatry and continues its long-standing practice of strict scrutiny process of membership applications. However, we are happy to share that our members have grown in number, and in each EC meeting, there are new applicants to consider. The pandemic threw up multiple challenges, and the IABP recognized the growing gaps in postgraduate training and interactions with teachers. Keeping this in mind, we initiated monthly webinar programs that have been since become very popular with our senior and budding colleagues alike. The first Friday CME series always runs over time, owing to the rich discourse and Q&A with experts. We're grateful to our faculty and glad to see such enthusiasm for biological psychiatry. This is also reflected in the number of submissions for free and award paper sessions we had this year. The selection committee had the arduous task of sorting out the numerous abstract submissions, and in a short period of time, they gave us selected 7 oral papers, 24 posters, and 4 award papers. Similar gratifying response was seen for the quiz contest that we are going to have tomorrow, with a record 64 candidates which are going to compete tomorrow at 12 o'clock. This we thought deserved a sweetened pot, and along with the prestige of winning, cash prizes will be awarded to winners of ASHA. Cash prizes will be awarded to winners of ASHA Award, the quiz, oral, and poster sessions. This was a brief report from me about the ANSEP IABP. With this, it's an absolute pleasure for me to introduce to you our esteemed guest of honor, Professor Pratibha Murthy. I have hounded her, and she's been ever so sweet and patient with me, and has agreed to join us as our chief guest of honor. She's been an inspiration to a whole lot of us, especially for women psychiatrists all over the country and the world. Dr. Murthy does not require any introduction but I must do the formalities. We all know that she's currently the director of National Institute of Mental Health and Neurosciences, NIMHANS in Bangalore. Dr. Pratima has 30 years of extensive experience and exceptional accomplishments in the field of mental health, especially in the areas of addiction. She serves as a constant consultant at prominent international agencies such as United Nations Office on Drug and Crime, International Labour Organization, and WHO. She served as a resource person for various flagship training programs in substance abuse prevention, tobacco cessation in our country and across the globe. Recently, she was honored with the WHO Regional Director's Special Recognition Award on World No Tobacco Day 2021 for her remarkable services. She's a prolific author and has more than 300 research publications, various international index journals, and scientific books to her credit. All of this is just but a tip of the iceberg. So with that, I invite Dr. Murthy to address us and all our delegates with her words of wisdom.
Thank you very much, Rukshida, for that very generous introduction. Dr. Lakshmi Atam, all the dignitaries of the association, all the participants at this conference, ladies and gentlemen. If I remember right, it was possibly 18 years ago that the first conference was held in West Diga. And I remember the presentation as much as I remember my journey to West Diga. Yeah. And, it started off in a small way. I think there were less than about 100 people at that conference. And I remember speaking on the biology of addiction, on the neurobiology of addiction. And I can see that since then, the conference has grown from strength to strength year after year. And it's fascinating to hear Dr. Mittal say that there are more than 2,000 people watching this particular, the proceedings of this conference. I can see that in the first session, a lot of my young colleagues have been speaking about neuromodulation. And there are many other exciting topics, including the ethics of not only neuromodulation, but various other kinds of research in vulnerable populations. I see there are topics on OCD. And just a little while ago when I logged in, I heard the fag end of the discussion of neuro-COVID syndrome by the ever energetic Dr. Mohandas and the neurobiology of mental well-being, which I'd have loved to hear in more detail. I just caught the fag end of it and the concluding comments of Dr. Savita Malhotra. Nevertheless, what I see, and is very interesting to me, is that the fact that, something that Dr. Sunil Mittal mentioned, is that we are not talking of biology neurobiology in a vacuum. And I think that's really the progress that we need to make, is really to look at things in an ecological perspective. Of course, there is biology, but the fact that biology constantly interacts with the environment, with our social milieu, and actually produces so many different changes. We all know that there are epigenetic changes that can occur because of environment. And therefore, I think anything that brings various kinds of disciplines together to provide a coherent understanding of why our brains behave the way they do, why our minds behave the way they do, is really going to further understanding. So, and it's also very exciting that there are more than 25 posters in this conference. And I know there are free papers as well. And I think getting young people to get interested in making presentations and really thinking about this whole area is something that I hope this conference will achieve. It's also exciting that a lot of younger psychiatrists like Dr. Rukshida herself are taking an active interest in, taking over the mantle of some of the responsibilities of the association. And I think that speaks very well that things are in safe hands, and the enthusiasm and the interest in learning is being fostered and strengthened from generation to generation. So I just wanted to wish the conference all success. I'm sure it's going to be very, very stimulating, from wellness to various kinds of interventions. I think you have a huge gamut of themes that you're going to be talking about. I wish I could have joined all the scientific sessions, but nevertheless, I'm sure I will hear little snippets of what happened and what interesting discussions occurred. So I wish the conference all success and thank you for inviting me. Thank you very much.
Thank you so much, ma'am. With this, it is an absolute pleasure for me to invite our beloved president, Dr. Yusei Garg. He's been truly a gem of a person to work with, and he never tires with so many the barrage of questions that I point out to him, and I rely on him for proofreading because I really am pretty bad at it. So he's been a pillar of strength, and he's made all of this possible today. Dr. Garg, please share a few words.
Thank you, Ruxida. Good evening, ladies and gentlemen, dignitaries on the dais, Honorable Chief Guest, Professor Lakshmi and Yatham, the President of World Federation of Societies of Biological Psychiatry, Guest of Honor Professor Pratima Murthy, the Director, National Institute of Mental Health and Neurosciences, Vice President, Indian Association of Biological Psychiatry and Chairman, Organizing Committee, Dr. Sunil Mittal, Patrons of the Organizing Committee, Madam Dr. Neena Bohra, Dr. Rajesh Nagpal, Honorary General Secretary IABP Dr. Ruxida Saida, Co-Chair Organizing Committee Madam Dr. Smita Deshpande, Honorary Joint Secretary IABP Dr. Abdul Majid, Secretary Organizing Committee Dr. Deepak Raheja, Honorary Treasurer IABP Dr. Prasenjit Ghosh, Honorary Editor IABP Alim Siddiqui, Joint Secretary Organizing Committee Dr. Ankit Gupta, EC members, Past Presidents IABP Dr. Ankant Mittal, Dr. E. Mohan Das, Dr. M.S. Reddy, Dr. Deep Prasad Rao, and Dr. Rajesh Nagpal, esteemed faculties and dear attendees. It is a matter of great pleasure to welcome you all in this 17th Annual National Conference of Indian Association of Biological Psychiatry held in Delhi, though at a virtual platform. The IABP started its journey with a handful of psychiatrists having true inclination towards biological psychiatry, led by Dr. E. Mohan Das, Dr. Ankant Mittal, Dr. Rajesh Nagpal, by organizing its first national conference in the month of November 2005 in a small city having a very beautiful and longest beach of India known as Diga, West Bengal. Since then, the association is growing leaps and bounds, resulting that now the membership of IABP constitutes about 1/10 of the total membership of World Federation of Societies of Biological Psychiatry. It is all when the IABP is having a very strict inclusion criteria for psychiatrists to become its member. During last many years, our members were given various responsibilities in the World Federation too. Dear friends, your organization is committed to achieve its aims and objectives by promoting and advancing biological psychiatry as a specific field of interest in the psychiatry amongst psychiatrists and other interested in the subject, and further advancing education and research in the field of biological psychiatry, so to the overall growth of biological psychiatry in India. And for achieving its goal, IABP has been conducting CMEs and conferences and instituting awards to encourage original research work. IABP has proposed to have future CMEs with faculties from sister member societies of World Federation also. At the same time, a blueprint of scientific journal is being drafted for publishing the research work in India. I'm very much hopeful that when we enter in 2022, we will be having our journal with us. The 17th Annual National Conference of IABP is a very special, as it is going to be inaugurated by President World Federation of Societies for Biological Psychiatry, Professor Lakshmi and Yatham. This is second time in last 13 years that I have an opportunity to share the dais with Professor Lakshmi. First time was on January 27, 2008, when I was given responsibility as a local organizing secretary to hold the International Conference of International Society of Bipolar Disorder in New Delhi and Agra, when Dr. Lakshmi was president of ISBD. Dr. Lakshmi and Yatham is a name of world leaders in psychiatry. A name even a first-year student of psychiatry knows when he or she goes through the chapter on mood disorders in various textbooks throughout the world. If I go introducing Dr. Yatham formally, it may exhaust the whole day. In fact, his CV is equal to a book, and his book And this book contains pages of A4 size. So very, very briefly, as a customary, I introduce our chief guest as follows. Lakshmi Yatham is a professor and head of the Department of Psychiatry and director of the Institute of Mental Health at the University of British Columbia in Vancouver, Canada. He is also the regional head of psychiatry and regional program medical director for mental health and addictions at Vancouver Coastal Health and Providence Healthcare. He has an executive MBA in healthcare from the Southern School of Business. Dr. Yatham has held leadership positions for national and international professional organizations, including president of International Society for Bipolar Disorder. He is now the president of World Federation of Societies of Biological Psychiatry and the editor-in-chief for the Canadian Journal of Psychiatry. Dr. Yatham was listed in the Clarivate Analytics 2017 to 2020 reports and Thomson Reuters reports on world's most influential scientific mind 2014 and 2015 as one of the most highly cited researchers in the psychology in the world based on research published since 2002. Dr. Yatham's major area of research interest include neurobiology and treatment of bipolar disorder and major depression. Dr. Yatham has received a number of awards during his career, including the Michael Smith Foundation Senior Scholar Award and NARSAT Young and Independent Investigator Awards for Research, Distinguished Medical Research Lecturer Awards from the Faculty of Medicine UBC for his research contribution and many more other awards. Dr. Yatham has a Google Scholar high index of 84. He has published over 370 papers in peer-reviewed international journals, including in high-impact journals such as Lancet Psychiatry, Molecular Psychiatry, Archive of General Psychiatry, American Journal of Psychiatry, World Psychiatry, Biological Psychiatry, and British Journal of Psychiatry. He has edited books and written a number of book chapters, including a chapter on treatment of mood disorders for the current 10th edition of Kaplan and Sadok's Comprehensive Textbook of Psychiatry. In addition to being the editor-in-chief for the Canadian Journal of Psychiatry, he sits on the editorial boards of a number of journals, including Bipolar Disorder, World Journal of Biological Psychiatry, Journal of Affective Disorder, Dialogue in Clinical Neuroscience, Acta Neuropsychiatrica, Australia and New Zealand Journal of Psychiatry, Human Psychopharmacology, etc. With this brief introduction, I invite Dr. Lakshmi Yatham to kindly formally inaugurate the 17th Annual National Conference of Indian Association of Biological Psychiatry and give his inaugural oration. Dr. Yatham.
Thank you so much, Uttam, for that very kind introduction. When you asked me to send a brief CV, of course, I have one of those standard formats that I send it around, but I didn't mean that you were going to read most of it. But in any case, thank you so much. It's a pleasure to see so many friends and colleagues at this conference. And as you all know, one of the main objectives of the World Federation of Societies of Biological Psychiatry, of course, is to facilitate and support research in biological psychiatry all around the world. Of course, when I heard Sunil mention that this conference has attracted over 2,000 delegates, that's just fantastic job, because as many of you know, when COVID hit, most organizations sort of switched to virtual format. And when the conference was switched to virtual format, the attendance for the meetings that were held in the initial months of the onset of COVID was very good. But I would say in the past 6 months, the attendance for most of the congresses, including well-known international congresses, has dwindled. I think the CINP, the latest one, has attracted something like 400 or 500 delegates, which is a conference, if some of you may remember, used to attract 10 to 15,000 delegates from around the world. So considering that, I'm particularly pleased that you've been able to attract over 2,000 delegates to this conference. And I think, to me, that speaks very clearly to the interest in biological psychiatry among its trainees and colleagues in India. And I would say that is largely thanks to all of you that are here as leaders in the field in India. Because just going back, when I was training in psychiatry at NIMHANS a number of years ago, I won't say exactly when, but a number of years ago, there was very little research was going on in biological psychiatry in India those days. And of course, you can bet that if not much was going on at NIMHANS, not much was going on elsewhere in India. And those days, I think Prasad will remember, he was 1 year senior to me at NIMHANS. We used to get very excited to hear about things like dexamethasone suppression tests as a diagnostic marker of depression, or looking at urinary MHPZ levels or CSF 5-HIA levels to predict what kind of patients with depression will respond to what kind of antidepressants, amitriptyline, desipramine, and so on and so forth. So we used to get very excited about biological research, but we really didn't have a whole lot of resources to do original research. So if any kind of biological research was going on in those days, it was mostly kind of replicating what someone else has done. Now, fast forward that by 20 odd years, and I will say that biological psychiatry in India has come a long way. Now I routinely see lots of our trainees, colleagues presenting at international conferences, winning awards for posters, oral presentations, and also fellowship awards, and so on and so forth. So things have changed a great deal. And I think, as I said, this clearly attests to leadership of some of you in taking that active role in promoting biological psychiatry in India. So the question is then, though, just looking at the future, where do we go from here? Where should India invest in what areas should India focus in biological psychiatry itself? Now, I think to answer that question, I would say we need to look back and see where most of the progress has been made in biological psychiatry. And if we look at some of the areas such as genetics, for example, there's been a bit of incremental progress. I think, again, Prasad and many other colleagues will remember that even when we were studying, a number of years ago, we did know that many psychiatric disorders, particularly the major ones, do have a significant genetic component, and there's clearly environmental contribution as well. And I think after billions and billions of dollars have been spent, I think what we learned about genetics is that many of these disorders have polygenic in nature with significant environmental contributions, all right? With each of the genes that's been identified contributing to a very, very small effect, maybe 2 or 3% or something like that. So sadly, the yield has not been that great. We've also, with progress in technology, we've also spent a lot of resources to try and understand neurobiology of the illnesses. And I would say, I think what's become increasingly clearer is that most of the disorders that we classify as schizophrenia or depression are really very heterogeneous. The chances of we ever finding a particular neurochemical abnormality or a marker that shows that a given person has schizophrenia or depression is just pretty low. So I think, again, the yield there is very, very low. I think where the field has been most progress is in the area of development of new treatments for various conditions. And again, just looking back and just reflecting on my own area of interest, which, as you all know, is mood disorders, and in particular bipolar disorders. So when I was training at NIMHANS to manage patients with acute mania, we were primarily using haloperidol and chlorpromazine. Pretty much that's pretty much it. And occasionally we used lithium. Now look at where we are at now, and if you have had a chance to look at the CAN-MAT guidelines for bipolar and looked at some of the first line or second line treatments that we recommended, there's a long laundry list of medications that one can use to treat acute mania. So things have things have changed a lot. We have many new treatments for managing acute mania. And the same story with the bipolar depression. You know, we used to use traditional antidepressants such as amitriptyline, desipramine, all of which we now know switch patients from depression into mania. And that's changed now as well with some specific treatments for bipolar depression. And we also have treatments for preventing relapse of mood episodes in bipolar with some of the anticonvulsants and a number of atypical antipsychotics being effective as well. So I think treatments is probably the area where the field has made a lot of progress in the last 20 years. Now, just looking at the research landscape, that's probably one of the areas India can probably do better than anyone else, anywhere else in the world. And the reason I say that is because, you know, we have access to patient population, better access to patient population in India than anywhere else in the world, you know, in terms of recruiting people for clinical trials. That's not because people will readily participate. It's because you have a larger population to draw patients from. And that's a significant competitive advantage for researchers interested in biological psychiatry in India, I would say. And so I think that's where, if I were developing a research strategy for India, I would say, you know, that should probably be one of the priorities. And I think there have already been, we're already beginning to see some innovations there with some of the studies that are being done in India. And in terms of new treatments, I think there was the endoxifen that came out of India, and that's where, you know, the first trial was done and got approved, and that's not available elsewhere for treatment of bipolar disorder. You also have unique expertise in some of the alternative and complementary treatments in India, and those may be the areas that one might want to think about pursuing. The other thing, again, going back to 80s, you know, one of the things we used to think about is predicting treatment or response. And I do think that that's where the field is going to go in the future. Developing new treatments is one thing, but we still need to figure out what treatment works for what person. So the precision psychiatry or personalized medicine is the sort of direction that we would want to think about moving towards. Looking for biomarkers, pharmacogenomic strategies to try and identify who will get better with what kind of treatment. Psychiatry probably is where, you know, cardiovascular and cancer field was 15, 20 years ago. And as we all know, you know, those fields have made a lot of progress in those areas. Just looking at the conference program, you're probably going to say to me, none of what you're saying is new to us, because The conference program, in fact, has covered some of these topics. I see presentations on neuromodulation, presentations on biomarkers, presentations on pharmacogenomics. So clearly, biological psychiatry is already at the forefront in India. Pretty much you're all doing great things and the right things. So I would say keep up all this great work. And I do think that conferences such as this are clearly catalysts in promoting that interest in biological psychiatry. So I do want to take this opportunity in my role as the president of the World Federation of Biological Psychiatry, and also as someone who was trained in India, and as someone who is very proud to see all this progress being made in India. So I do want to take this opportunity to congratulate you and also thank you for all your hard work. So all the best, and again, thank you very much for inviting me to be at this conference.
Thank you so much, sir. We do have Dr. E. Mohan Das with us. So before I invite our secretary for a vote of thanks, Dr. E. Mohan Das, if you could share a few words.
I don't know what I have to say. Lakshmi knows it.
Thank you so much.
And many of my friends knows it. How did we start this program in biological psychiatry? It was just long back when I was in Korea. I was sitting with Joseph Zohar, and privately we discussed. Then we thought that we will start a program. And then Garg also has told the first biological psychiatry meeting was in Digha, where Joseph Zohar was there with me, and Pradima, you remember, you were a guest speaker there. And then since then, the team of people who were with me, they did wonderful job to welcome other people. Now it is our duty to see the new people taking over this type of program, as Lakshmi has suggested. A good work, research work, especially we have got the wonderful centers like NIMHANS, which very few people, Pradima can do it, she's a director, and Venkat Subramaniam and Sanjeev and others can do it. But even many people in private practice, as Lakshmi has suggested, they can have some comparative studies on some of the drug trials. They can do it. They can do some of other techniques like yoga and biological phases, which my friend BNG is doing with Urvak and other people. I don't want to tell. So we have got some selected areas. And Lakshmi also has pointed out something which is important for India. We have to really look into some of the indigenous background. We have got that's called nutritional psychopharmacology and nutritional neuroscience, wherein many of our system, Ayurveda or other herbal medicine, I think we can try to really can cooperate with them. At least Ayurveda, I can vouch that I can make anyone contacts, because my own Ondi's place is Kottakkal, my own relatives' place is Coimbatore Pharmacy. So I can make some liaison activities. Those people who are interested in hands or other people in biological psychiatry, they can work on it and they can come out with papers. I am old. I am getting old, 68 plus now, and I don't do much research. I do only teaching. And I think many people would have bored with my lectures and others. Anyway, we have got a good link with our own Indian people internationally. Lakshmi is there, Kesh is there, Keshavan is there, Rajiv Tandon is there, Rohan Ganguly is there. All are our close friends. And similarly, people are there, Siegfried Kasper, where many of the people, Joseph Soher, I need not name, Anthony Grace from USA, we are all very close. And they usually come to India. I think biological psychiatry, the officialdom has to take up the so-called contacts and motivate the youngsters and the centers to do some work, and at least the image of India will be brightened in the near future. I think Lakshmi will endorse with me. I think we have to see a brighter India, especially in biological psychiatry, also in other fields also. And most of the Indians who are abroad, whether in United States, UK, Canada, or anywhere, they are all ready to help us, at least motivate us, give guidance to us. And that is with that mission that we started IGPA also, Indo-Global Psychiatric Initiative, which Lakshmi knows it, to give some directions, to guidance to the young researchers. I stop short here. I am very happy to see Lakshmi and Pradima, because Pradima, she looks older than me, though she is younger to me. Similarly, Lakshmi is also very young to me, but they have put the hair that way. Sunil Mittal also, the same pattern, beautiful hairs. But I don't want to get old, you know. I want to be young. Thank you very much, Lakshmi, Pradibha, and all others, Gargi, Garg, and everyone. Thank you.
Namaskar.
Thank you so much, sir.
Namaskar.
With this, I invite our organizing secretary, the very talented Dr. Deepak Raheja, to give us a formal vote of thanks.
Dr. Rukshida, thank you very much. President Dr. Uttam Garji, Vice President Dr. Sunil Mittal, Chief Guest of the evening, Dr. Lakshmi Yatham, Madam Pratima Murthy-ji, Prasad Rao sir, Dr. Mohandas on the dais, Dr. Abdul Majid, the founding members of IABP, Venugopal Chhavar, Dr. Anukant Mittal, Dr. Rajesh Nagpal, some of the luminaries who are not seen here, but I take this opportunity, having listened to the various topics being deliberated today, I was almost tempted to identify myself in future, or want to identify myself as a biological psychiatrist. I have attended in the COVID era, the virtual conferences became a norm. I may have had the opportunity to attend many, but the kind of interest we have seen in this conference is phenomenal. And this figure of 2000 plus is something that's concrete. We saw these registrations, we saw these people log in, which shows that people realize that if we don't want psychiatry to get merged with neurology, we will have to keep the research and understanding in psychiatry to interface and liaison with the neurological, the organic, the biological aspects. It has been a great opportunity in the organizational aspects of this conference. It may have not been possible without the unhindering and unconditional support of our President, Dr. Uttam Garg, the organizing chairperson, Dr. Sunil Mittal, who's also a mentor. We look up to him in terms of how he's carried himself and how he practices and how he guides us. The chairperson, Scientific Committee, Dr. Prasad Rao, sir, we thank you very much. And of course, listening this evening to Dr. Mohandas and Dr. Rajesh Nagpal made me feel very proud that we have speakers of international stature and who have that in-depth understanding and the knack of imparting education the way they did. Thank you very much, sir. Our chief guest, Dr. Lakshmi Yatham, Professor Murthy, Pratima Murthy-ji, we know how busy you are, but thank you very much for taking out the time to be with us this evening. We feel truly honored and blessed by the kind words you've shared, which makes it very encouraging. Dr. Abdul Majid, who's been part and stood besides and guided, who's also a very, very dear friend. My joint secretary, whom I don't see here right now, Dr. Ankit, again, very, very supportive. This vote of thanks would really be incomplete if I do not come back to Dr. Rukshida, who's really at every step been very, very forceful, very powerful, very, very visionary, preempting all the things. I mean, sometimes seeing how she works makes me feel that maybe the anencastic parts of traits can be so useful and can be so instrumental in guiding us the way to almost get close to perfection. Like she said, Dr. Uttam Garg, Dr. Mittal were available all throughout in helping us proofread, helping us with every step of the organizational details, in helping chalk out the scientific program, which was given to us by the scientific committee, and they guided us, and we were able to put everything together. I thank very much the tech company who've been with us all throughout. The vote of thanks, of course, will be so incomplete without thanking our academic supporters and sponsors, which are primarily the Sun Pharma and the INTAS, who've been very, very generous in their academic grant and support. Thank you very much, all of you. The evening, of course, gives us the honor of unveiling a scroll, which we will begin by first conferring to our guest of honor, Professor Pratima Murthy. It is on behalf of the organizing committee and the office bearers of IABP. It is our honor to present this scroll to you. And of course, to Dr. Lakshmi Yatham, sir, thank you very much for your kind words. These are scrolls that we'd like to present and unveil to you in honor of your agreeing to participate and share your kind words. We will mail these to you in a very beautiful format, which will be delivered to you at your home. Thank you very much, all of you. I hand over back to Dr. Rukshida. Thank you very much. It has been an honor and pleasure being here this evening, and I eagerly look forward to be here tomorrow morning. And I nudge you, I request you for all the delegates, thank you very much for listening so intently, and we look forward to seeing all of you tomorrow morning. Thank you very much. Namaskar. Over to Rukshida.
Namaskar.
Thank you so much, Dr. Deepak Raheja. May I please request everyone to rise for the national anthem? Thank you so much. With that, I invite the organizing joint secretary, Dr. Gupta, to take over the proceedings.
Thank you, Dr. Rukshida. I would like to take this opportunity to welcome the chairpersons for the next session. Dr. G. Prasad Rao, he's a director and consultant psychiatrist, Asha Hospital, Hyderabad, and also the chairperson of the scientific committee of IABP. And Dr. Rukshida Saida, she's the honorary secretary and a consultant psychiatrist and psychotherapist at Trellis Family Center in Mumbai. I would like to invite them to start the next session. Thank you.
Thank you very much. It's a great honor indeed for any association to listen to the presidential address. And what a great way this conference has unfolded till this point of time.
Prasad, we cannot hear you. We cannot hear you.
Now, hello.
Yes, now audible.
Hello. Yeah, I'm audible.
Yes, sir.
Yeah. What a great day today. Uh, it's a great honor and privilege for any association, especially for our Indian Association of Biological Psychiatry, to listen to the presidential address. And today, even more, I'm privileged to introduce my dear brother, Uttam C. Garg, whom I know for more than 2.5 decades. In fact, it's not a matter of simple fact. Factually, both of us worked together. When he was a secretary, I organized the conference in Hyderabad. And when he was the secretary of Indian Psychiatric Society, I was the CME chair. And we know each other temperament. And during my term, he has organized the conference in Agra. He's a great person, in a way, very humble, very polite, sincere, honest, and any person would dream, for example, he's from high school to medical college to MD, he has done in Agra. And following that, he started his practice in Agra after a brief working there. He is affiliated and reached the pinnacle of most of the associations. He was the Honorary General Secretary for Indian Psychiatric Society. He is currently the president of our Biological Psychiatry Association, Indian Association. He's also a president-elect for the Indian Association of Social Psychiatry. More than that, he's there, here, there, and everywhere in organizing a lot of conferences and very successfully so. Sir, it's a great privilege to chair your session. And of course, your wise pearls of wisdom will be very useful for the youngsters. And without much ado, I would invite Professor UC Garg to deliver his address.
Thank
Sir,
you.
before he starts, I must add here, sir, I don't think I've thanked him ever because unbeknownst to him, when he organized the first SARC Federation meeting in Agra, I had attended as a young psychiatrist, very naive and an infant really, and that set my career off to a course that I had not imagined for myself. So for that particular thing, sir, I owe you a huge debt of gratitude. Thank you so much. Sir, it's always a pleasure to hear from him, but I am particularly excited about his topic today. His presidential address is going to be on precision medicine and psychiatry, and that is the future, isn't it? Sir, please, I cannot wait to hear your presidential address. Welcome.
Thank you, Ruxida. Thank you, Dr. G. Prasad Rao, for giving my introduction in such nice words. Am I audible?
Yes, sir.
And my slides are visible?
Yes, sir.
Thank you. Good evening, everybody. It is my privilege and it is an honor for me to give a presidential address in this 17th annual conference of Indian Association of Biological Psychiatry. It was really difficult to choose a subject to speak on. And I am very much surprised that in inaugural address, Dr. Lakshmi Yatham mentioned about the importance of precision medicine in psychiatry. I was a little bit excited. So, what is the precision medicine in psychiatry and why we should go for precision medicine in psychiatry? This is the main aim of my lecture in this presidential address. It can be argued that amongst the disciplines of modern medicine, psychiatry is perhaps the most personalized or precise, with patients at the center. However, in psychiatry, with a wide array of interventions available and patients coming from constellation of personal factors, a lot of scope arises to further tailor the treatment offered. Central theme of personalized medicine is the premise that an individual's unique physiologic characteristics play a significant role in both disease vulnerability and in response to specific therapies. Term precision medicine is used in preference to the personalized as to avoid implying that each technology or technique is developed for individual patient. Rather, it depends on using such techniques or exact measurements which will allow us to choose a package of treatment that is most suited for each person. So, precision psychiatry thus tries to deal with two unresolved dilemmas that currently are widely acknowledged to cloud the scientific validity of evidence-based psychiatric practice. One is how to conduct treatment research based on fuzzy phenotypes that do not represent valid stratification. And second, how to work with patients at the required idiographic level on the basis of data at the nomothetic level. A modern definition of personalized medicine is stated as an approach to disease treatment and prevention that considers individuals' differences in genes, environment, and lifestyle, based on the understanding that some of the complex combination of someone's personal characteristics like culture, genetic profile, the bacteria in mouth and intestine, the personalities of father and mother, the place one had in the family, the attachment to both parents and so on are the physically represented by biomarkers. Major goals of personalized medicine are therefore to predict an individual's susceptibility to developing an illness, achieve accurate diagnosis, and optimize the most efficient and favorable response to the treatment. So, personalized medicine in psychiatry can entail levels of healthcare delivery and access, implementing treatment plans based on personal characteristics of the patients like psychopathology, personal history, pre-morbid functioning, family history, physical comorbidities, cognitive function, environmental and lifestyle. Why we need precision medicine in psychiatry? To an extent, the high burden of psychiatric morbidity in the general population is contributed by our limited understanding of pathophysiology of psychiatric disorders. This is further compounded as symptoms overlap considerably among different diagnoses, while varying greatly among patients with same diagnosis. The response to medications and therapy is also similarly variable, affected by multiple factors. A combination of biological markers and clinical variables is the most promising strategy that at present has been suggested to reach a valid individualization of the treatment. What we expect from the precision medicine in psychiatry? The precision psychiatry paradigm will lead to the discovery of biomarkers able to guide treatment choice and predict treatment response. Eventually lead to a personalized treatment will differ from personalized medicine. A given patient would receive an existent treatment pre-established according to the patient's disease class and not a medication that would be specifically created for that individual following consideration of their unique features, as would be the case in personalized psychiatry. There can be multi-strategy approaches by biomarkers, data-driven discoveries. We know biomarkers can be indicators of pathophysiology, risk for pathophysiology, or treatment outcome. But we also know that there is not a single marker that can explain a psychiatric diagnosis entirely. So there are data-driven discovery to delineate the multivariate and the combinatorial profile of biomarkers, and they can account for heterogeneity of mental illnesses as they manifest clinically. Further, advance of omics techniques have contributed to foster our understanding of neurobiology of major mental disorders. Omics science are system biology related fields that involve multiple levels such as genomics, metagenomics, epigenomics, transcriptomics, proteomics, metabolomics, and liptomics independently provide valuable information about the neurobiology of mental disorders, and therefore they are regarded as a data-driven approach to mental disorders. There are some examples like genetics and imaging. Ojomaro and colleagues, for example, have reviewed the progress of precision medicine in major depressive disorders, bipolar disorders, and schizophrenia. They describe how genetics and epigenetics influence the heritability of these diseases and their role in predicting treatment response. Appert et al., which studied the relationship between voltage-gated potassium channel genotypes and treatment response to atypical antipsychotics in schizophrenia, finding significantly greater improvements for patients with certain genotypes, where the TT genotypes were higher on the side than the TC or CC. This provides some evidence that genotyping has the potential to influence treatment choices for patients with schizophrenia. A positron emission tomography study showed that treatment-resistant schizophrenia subjects who do not present drug-induced changes in presynaptic dopamine transmission as observed in subjects who respond favorably to antipsychotic treatments. Some other examples of the approach for the precision medicine is machine learning. Various machine learning techniques such as random forest, support vector machines, linear discriminant analysis, and k-means clustering have been applied to highly complex data sets. These tools are capable to predict the response to treatments, predict the outcome, as well as to cluster patients on the basis of biological or behavioral aspects. A tool to evaluate the participants' proneness to a disorder and subsequently to design the neurofeedback sessions aimed to modulate participants' functional connectivity. A recent meta-analysis evaluated previous studies using machine learning, devised models to predict therapeutic outcomes in unipolar and bipolar depression. In another study, the authors identified a signature of 3 genetic variants related to treatment outcome that, combined with the absence of melancholy, were associated with a decline in HAMD scores less than 17 in 62% of the patients with this combination compared to 34% in the whole study population. Other biological markers. There are studies investigating biomarkers besides genotypic data, like peripheral messenger RNA. Levels of selected genes might also inform machine learning models. This approach was applied by a recent study showing that baseline expression levels of 6 genes selected from genome by transcriptome data reached 0.76 accuracy in predicting non-remission after 8 weeks of treatment with citalopram. A model integrating clinical variables with resting state functional MRI and 13 selected single nucleotide polymorphism was used to predict early response to antidepressants. A study based on high heritability of antipsychotics induced side effects developed a model on genetic data to predict extrapyramidal symptoms induced by antipsychotics. On balance, these data show that although falling short of the clinical significance threshold, predictive models based on purely biological data or integrating them with clinical information are starting to reach the accuracy needed to become implantable in clinical settings and showing in general low sensitivity but high specificity, implying that at least for predictive models of treatment response, it may be of importance to avoid a premature suspension of a drug trial, given that and eventual response would be highly probable. Some other examples of the approach for precision medicines are clinical predictive models. These also form a major tools in our arsenal. Identified and well-taught phenomena observed in clinical spaces. For example, response to lithium, prediction of resistance to antidepressant, stratification of risk and prognosis in psychosis. First criterion is past response. If a subject already received benefit from a specific compound, this is the strongest criteria for prescribing the same compound again. Secondly, if this information is missing, we may rely on the information about response in the same family. These are things that we do in our clinics without second thoughts on a regular basis. Among pharmacokinetics and pharmacodynamics interactions, all compounds have a variable degree of modulation of cytochrome P enzyme, leading to possible variations of plasma level of concomitant medications or the compound itself, which may lead to toxicity or to consequences deriving from an artificially lowered or increased plasma level. So in presence of medical comorbidities, a number of compounds may be contraindicated. The prediction modeling can be used to forecast the probability of a certain conditions being present. Diagnostic models, outcome, which can be prognostic models, or the response to intervention that is predictive models at the individual subject level. So what are the applications of precision medicine in psychiatry? All these observations and studies means little if they are not applied on a wider scale. This is a salient as psychiatry is traditionally not reliant on technologies or medical tests. The introduction of clinical guidelines clearly informing how such new technologies should be employed and evaluated in clinical practice will be necessary to guarantee the last translational step. Further, this precision medicine in psychiatry is applied at three levels: in clinics, in research, and regulations. Used in clinics, integration EPR notes, part of training; in research, further identification and characterization of tests and markers that carry consistency in what we measure; and regulations, where clear guidelines on what to use and how much to use, incentivizing and regulating at the same time. But there are barriers too. Multiple areas to consider, including limitations on utility, cost effectiveness, and stigma, etc. There are ethical considerations as well, finding a balance between patients' autonomy and dictation by clinicians versus holy grail test. Also, given that precision psychiatry is strongly related to the analysis of massive data sets, either phenotypic, neuroimaging, or biological, confidentiality and privacy concerns are becoming increasingly relevant. Stigma driven by being associated with an identifiable defect and patients being blamed. This has been a concern in other branches of medicine, and a social example could be recent cases of stigma associated with people with COVID-19. Equally important are the other obstacles which can hinder the implementation of precision psychiatry in clinical settings. Among these are the lack of an adequate knowledge of precision medicine tools, including pharmacogenetics and pharmacogenomics, in clinicians and mental health operators, and compliance toward precision medicine tools. Adequate training and education will be key to achieve successful results. Most importantly, cornerstone of psychiatric management is the biopsychosocial model. We must be cautious that increased emphasis on the biological component does not distract from providing appropriate and proven interventions both at the level of individual and broader public health-based initiatives. So, conclude my talk. Overall, the goal of any paradigm in medicine, including precision medicine in psychiatry, has to be alleviation of morbidity and improvement in patient's life. For this, a constant movement towards newer, better, and more readily accessible tools has to be sustained. This is to have more accurate diagnosis of ascertaining prognosis, guiding treatment, and predicting response to treatment, hoping to aid the development of new and better pharmacological and non-pharmacological treatments. Precision psychiatry suggests the need for increased patient stratification and integration of biological information, which can improve therapeutic response rates and thus allowing us to move away from one-size-fits-all protocol treatment approaches. It is crucially important to make a clear distinction between precision and personalized psychiatry, as personalized psychiatry considers the complex interactions between biology, behavior, environment, cognitive, and social processes and patient's perspective, while precision psychiatry focuses mainly on the biological and arguably phenomenological mechanism of mental disorders. Precision psychiatry aims to integrate biological and environmental information to personalize treatment and complement clinical judgment. Pharmacogenetic biomarkers in cytochrome genes were included in prescribing guidelines and represented an important steps toward precision psychiatry. The creation of pharmacogenetic services within the healthcare system is a challenging and multi-step process. Education of health professionals, promotion by institutions and regulatory bodies, economic and ethical barriers are the main issues. In summation, it is a complex interplay of multiple factors, each with its own salience. Precision medicine can give us a higher efficacy, give us an opportunity for higher efficacy, reduced adverse effects, decreased cost, and drug repurposing with the help of drivers where deep phenotyping, integration of clinical and molecular data, and machine learning. But there are barriers to cost, stigma, ethics, physician awareness, bureaucracy, drug-drug interactions, food interactions, compliance, scarce reproducibility among studies. These are some references, and it is acknowledgement for my son, Dr. Kavirgar, and my daughter, Dr. Kashvigar, both are psychiatrists, and Kashvigar is working with me. Thank you all. Thank you very much.
Dr. Garg, truly giving and living with the current and moving to the future. I think you have really presented during your presidential address your vision and views so wonderfully well, bringing the most precise in the limited time, which I know we have a crowded scientific session. But thank you very much for a wonderful lecture. And yes, we are hoping to see your term to be much more academically brilliant as like your presidential address. Rukshida?
Thank you so much, sir. It's always really enlightening to hear, sir. And when he had first mentioned that this is the topic he's going to be speaking upon, I really wasn't surprised that he was so innovative and so forward-thinking and with such a far sight in biological psychiatry. It was a pleasure, sir, to chair this session of the presidential address. This is my first annual conference as an honorary secretary, so I don't think this honor is going to get bigger than this. With this, I wish all our delegates here good night and good evening, because we are going to have a next session, which is the annual general body meeting of the Indian Association of Biological Psychiatry. Thank you, Dr. Garg. Thank you, Dr. Prasad Rao. And I see you guys in a minute.
Thank you.
Recording stopped.
So do we, Prashant,